University College London performed a study that some people feel has put the nail in the coffin about ssris, the most common depression medication. It's not about whether or not these medications work, it's more about how they work, and the theory of depression itself. You see, a lot of people have thought that depression is a serotonin deficiency, and that by taking a pill, you can give a person enough serotonin that they no longer feel depressed. Well, it looks like depression is not that simple. Now, a lot of my colleagues have known this for quite a while, but it's difficult to counter what people think that they know out there. It's true that in double-blind studies, people taking ssris frequently do feel better. The question is why? And the answer that many people accepted, being a serotonin deficiency, is not the right answer. Now, I've been saying this for a while, so I like this study. I think that when a psychiatrist only gives a patient a pill for their depression, they are not giving them all that they could. When a patient comes to me asking for help, I'm gonna throw the kitchen sink and the bus at them. Yes, we're gonna give some pills, but we're also gonna try every other thing that might be linked to their depression. I'm gonna share with you a couple of the main things that I recommend. First of all, exercise. The studies showing the benefits of exercise on your mood are undeniable. Choosing not to exercise is like choosing to be more depressed. Do at least 30 minutes of cardiovascular exercise, getting your heart rate around 120 a day. Clear this with your primary care physician first in case you have any health risks. Try to do this at least 3 to 5 times a week. Human bodies need exercise. Besides, look at this lady here. Doesn't she look happy? The next thing is people. Our brains need interaction. When people get depressed, they usually go off and try to be by themselves. This is probably the worst thing you could possibly do when depressed. Find people that love you and that you love and get close to them. For some reason, our human brains need this. Do not be alone. The third thing is healthy food. There is a lot of debate out there about what's healthy. I would just say this: avoid alcohol, avoid toxic substances, avoid simple carbohydrates like cookies and donuts, and avoid sugar, like simple sugar, like soda pop and candy. Start there. Next piece of advice is sleep. It is almost impossible to be happy without getting enough sleep. Google sleep hygiene. Avoid screens before bedtime, pick a routine, make the room dark, go to bed early. Next, actively seek a profession, a job. I can't tell you how many patients I've had whose depression worsened after they quit their jobs. Lastly, a hobby. Maybe your hobby is finding a hobby. You need it, find it, and do it, even when you don't feel like it. Good luck.